Hi, everybody. Good morning. Welcome back to another edition of Anatta Speaks. Today, we have with us the eminent gastroenterologist, Dr. Sanjeev Khanna, and we are going to speak on alcoholism and the gastrointestinal system primarily. Dr. Khanna is attached to Leelavati and Criticare hospitals in Bombay. He has been in the field of gastroenterology since 35 plus years and treated numerous people who have been affected by alcoholism physically, and to the extent that he had this misnomer called Daruwala doctor for many years. So, welcome, Dr. Khanna. Good morning to you, and
Thank you.
I hope you're keeping in good health currently. So,
I'm
can we start right away?
sure, Sujata. Sure. So
Yes,
I'm
doctor.
really thankful for this very gracious invitation from one of my very dear students, Dr. Sujata Nair, now who's in her own right a specialist and a physician in de-addiction and with tremendous experience in this field. So it's
So
really a
sweet.
pleasure and privilege to be with you, Sujata, and with the Anatta University,
Human.
human which specializes in de-addiction and treatment of these disorders. So thank
Yes.
you very much for the invite, Sujata.
Thank you, doctor, for gracing our this occasion. So, doctor, let's start directly. So, it's a huge topic to cover. So, just for our understandings of for people who are viewing us, what is our gastrointestinal system comprised of? If you could please elaborate on that, that would be great.
So the gastrointestinal system is possibly the one of the most important and the most essential system in the human body, without which survival becomes very difficult. And survival really, if it is there also, it's a very pathetic condition. You think of
Hmm.
yourself as being without food or without water for some time, and you will not see anything else, Sujata. You will only see images of food and water in front of you. So it starts at the oral cavity in the mouth, and then it's a long tube, the food pipe, the stomach, and about 25 feet of small intestine, followed by about 5 to 6 feet of large intestine, which opens to the outside world. The unique thing, Dr. Sujata, about the gastrointestinal system is that there is just one cellular layer thin which permeates the entire cavity, right from the upper
Hmm.
part to the lower part, especially in the small
Hmm.
intestine, which is your difference between the outside world and your world. Anything which enters you enters through the digestive system. The entire digestive process, the absorption and the elimination, and the energy which the human being has is dependent on the integrity of the gastrointestinal system.
That's great. Thank you, doctor. So, understanding it, taking it little further, doctor, that it is like, how does since our primary topic of today is about alcohol, and you have dealt with so many people suffering from addiction to alcohol and their physical effects. Like, let us start from the very beginning. Like, how does alcohol affect our oral health? Because people think that, it is just the liver that is affected, it is just the stomach lining that is affected. So let us dispel all those myths and begin with, how does alcohol to begin with affect our oral health?
So alcohol, in it's right from the time it enters your body in the mouth, it's a toxin, it's a poison, and surprisingly some of it gets absorbed even from the oral cavity. The effects which occur due to the absorption and assimilation of alcohol are various. In various ways they affect the oral cavity. They can have a direct corrosive effect. You Someone who's not used to alcohol, if he takes a very strong drink, the mouth burns, the throat burns, and that's due to the direct inflammatory effect on the oral mucosa. It also leads to problems in vitamin absorption. So a lot of vitamins
Hmm.
which you normally are required by your body. The oral mucosa, the mouth and the tongue and the cheeks are tissues with very high turnover rate. Almost
Okay.
every 2 to 3 days, the entire cavity gets, you get a new lining coming up there. So
Hmm.
the metabolic activity is very high, and so you need very large amounts of nutrition and energy coming in there. And the moment your energy levels or nutrient levels are low, especially vitamins like uh, niacin, nicotinamide, or
Hmm.
vitamin B1, thiamine, you get into deficiencies of this B12, iron, which every alcoholic gets deficient in. You will get burning and redness of the mouth, what we call glossitis and stomatitis. And you may get
Right.
ulcers in the mouth coming up. You will also get into what is called changes in the tongue. So the tongue may get bald, or the tongue may have different colors, like a magenta tongue. And anything you put on the tongue, salt or spice, will become very uncomfortable. Also,
Okay.
surprisingly, certain very rare trace elements like zinc and magnesium, they don't get absorbed in alcoholics well, and there are dietary deficiencies of this. And zinc is very important for taste perception, Sujata. So
Okay.
your taste buds will get altered, and you will not appreciate taste well, and you get into what is called ajuicia or dysgeusia, what is called medically, or simply means altered taste or lack of taste.
Hmm. Hmm.
So
Hmm.
also the teeth can get eroded, you can get dental caries, and surprisingly also, and very dangerously, you can also get oral cancers. So we must remember
Right.
all.
Right. Thank you, Dr. Khanna. That really and was quite an informative piece of answer, because we definitely have seen a lot of our clients who lose their sense of taste or have an altered taste where there is too much, where they become very sensitive to certain tastes and they prefer certain tastes, like they prefer a lot of spicy food or they're unable to tolerate any spice. We have seen both extents also that happens. So that was great to know. Thank you, doctor. So now then, what happens to our food pipe? Moving on from the oral cavity, what happens to the entire food pipe or the esophagus as a consequence of drinking?
Excellent question. So just imagine, that you've got a tiny cut in your finger, and you pour spirit on it. What is going to
Hmm.
happen? It's going to burn, it's going to sting, it's going to hurt like anything. So
Right.
the same thing is what alcohol does to the entire food pipe and the stomach. It's going to cause minor mucosal erosions there. It's going to increase your acid output and acid reflux, and it is going to in that way damage or cause what is called esophagitis or reflux. Very often there is a reflux of acid from the stomach into the food pipe. Because of the inflammation in the stomach, you get excessive acid output, and that can lead to further damage to the lower end of the food pipe and cause reflux. Also, the most of the alcoholics also might tend to put on weight, especially with certain alcohols, and that can lead to weight gain, and that can further aggravate the reflux, because the sphincter or the valve between the food pipe and the stomach gets more stretched, or you can get the formation of what is called a hernia, and that can cause a problem. So these are various issues. Also, in the long term, once you get liver damage, Sujata, you might get a condition what is called portal hypertension. And the portal hypertension then leads to formation of big veins which dilate. Just like you have veins at the back of your hand, similarly the veins in the food pipe start getting engorged or big,
Hmm.
and they can
Hmm.
sometimes burst and lead to vomiting of blood. So these are all the things
Right.
which can happen in the food pipe, and of course, last but not the least, increased incidence of cancers. So cancer of the
Right.
food pipe, stomach will all have higher incidences in alcoholics.
Okay, that's bad news for most people who are drinking then, especially those with addiction to alcohol. Right. So that explains a lot of the burning and reflux and acid that happens that they do experience. Doctor, you use the term portal hypertension. Could you please elaborate some on that? What is portal hypertension and how does alcohol create it or affect the pressure in that space?
Very good. That's the most important crux of the issue. We most people who have relatives or family members who are drinking will have will know or will have read or will have heard from somewhere that many times the end can come when the person vomits a big quantity of blood. So portal simply means entry. It's the doorway.
Hmm.
So the portal
Hmm.
vein is a large vein which come takes blood from the intestine, stomach, and takes all the nutrients to the liver. The liver is our main chemical factory, Dr. Sujata, and that gives us all the chemicals which it makes and the various important substances which it make life worth living. That's what they say. What is life without the liver? It's not worth living. So the each microsecond, the liver is having almost 500 chemical reactions going on. So all
Right.
this blood which is going to the liver, almost 20% of our blood volume, it when the liver gets damaged, or what is called cirrhosis of the liver. Cirrhosis simply means hardening or stiffening of the liver. The liver
Hmm.
normally is the largest organ. It is found on the right side of your rib cage, just below the rib cage, and it almost weighs 1.5 kilos, and normally it's a very soft spongy organ. But alcohol damages the liver and makes it hard and fibrotic. It almost becomes like a brick. And so all the blood circulation within the liver gets squeezed out because of this hardening of the liver. Imagine a sponge which can absorb a lot of water normally when it is soft, and the same sponge, if it is hard, and it will not be able to absorb the water. So all that capacious blood vessels then have to shunt the blood into another direction, and they shunt into the blood into what is called the systemic veins. From the portal veins which come to the liver, the
Hmm.
veins other veins start taking the brunt of the blood, and that enters
Right.
the food pipe. So the blood which
Ah.
enters the food pipe gets engorges those veins, and that is the effect of, that's what we call esophageal varices or gastric varices. And they are prone to bursting. Those veins become thin walled, and they can rupture anytime and lead to bleeding. So the normal pressure in the portal system is very low. It's just about 5 millimeters of mercury. The moment you get
Hmm.
cirrhosis, the pressure rises and it goes to 10 millimeters, 15 millimeters, 20 millimeters. The moment you cross 10 to 12 millimeters, your chances of bleeding become high.
Right.
That's portal
So
hypertension.
that's portal hypertension. So that is how we see many times that our a lot of our clients or whom I have seen admitted to hospital also suffering from alcohol related to portal hypertension. I've seen them vomiting literally buckets of blood.
That's right.
It's not just a few ml, but it's like literally buckets of blood, and it's like a spurt of vomit that comes out. And many times it can be too late to save such an individual. But today, because of modern science, we are able to help and detect. If it is detected in advance, then the person can be helped in advance. And especially if the person takes help for the alcohol condition, then that will be a tremendous boost to going back to a healthy living of life. So, doctor, tell me something. It's not that just because someone is drinking that the liver gets cirrhotic immediately. There would be stages prior to that. There would be time before that happens. So, how is does liver cirrhosis evolve? If you could please elaborate on that, so that I'm asking you this question, so that someone who is drinking heavily can be aware of this. There are a lot of families of people who are addicted, who have become addicted to alcohol, who are listening to us, watching us, and also people who might be still drinking or using, or their friends and family. So for them to understand, like what is, so that they can approach it in the right time, at the right time, to help their loved ones seek help at the right time. So, doctor, how does liver cirrhosis evolve? If you could elaborate on that, please.
So the initial stage, Sujata, is what is called a fatty liver or just enlargement. The beginning of liver damage occurs with fat infiltrating into the liver. The liver becomes enlarged and pushes down into the abdomen, and that is a stage where things can be reversed. That's called the initial stage of fatty liver or alcoholic fatty liver. Often
Hmm.
these patients are also obese, they may be having diabetes, and then you get another addition of fatty liver due to that coming in. So often the
Right.
damage is due to multifactorial reasons.
Hmm.
Fatty liver will occur in about 30% of patients who are drinking heavily, and overall liver damage initially can occur even with a small drink. So this whole thing of what we call social drinking, or I drink only at weekends,
Hmm.
if you do your liver function test the next morning after even a single drink, your tests like ggtp or sgot
Hmm.
sgpt can
Hmm.
show changes. So
Right.
about 30% of patients with fatty liver then will go on to another condition, which is where the liver gets inflamed, and that is called steatohepatitis. Whenever we say medically itis, it simply means that there is inflammation or more swelling, and the swelling is of an
Right.
inflammatory type, not just due to a bland swelling due to the fat. So just
Hmm.
like tonsillitis or appendicitis, same way
Hmm.
it is due to that,
Hmm.
due to inflammation occurring. But when you
Hmm.
reach that stage, you will thank you, Pankaj, for your kind comments. When you reach that stage, you are already tipping into the irreversible zone, which can come on. But if you stop here, again the
Hmm.
chances are good. There are good chances that you will recover. Almost 60 to 70% patients can recover or may get into a stage where the liver will not really trouble them.
Right.
The liver is a unique organ, Sujata. It has
Yes.
this tremendous capacity to take insult. So
Hmm.
almost 70-80% of the liver can be damaged, and still there can be no outward signs or overt signs of damage.
Hmm.
And then you come to the last stage where the liver starts getting harder and thickened and fibrotic, and that's what you call
Hmm.
cirrhosis.
Right.
Scirrhus in Latin simply means hardening. So once that
Hmm.
hardening starts occurring, then you have reached a point of no return. You are gone into what is called a stage 4 fibrosis, from where your
Hmm.
liver can only go downhill.
Right.
Still there is an opportunity, still there is a window of opportunity here too, that if you stop
Yes.
alcohol totally and take care of your other factors, your obesity or your diabetes, other factors, you might still not go into get tipped into what is called decompensation. So you will remain in a stage of compensated cirrhosis, and as I told you, the
Hmm.
liver is a great organ, so it will still manage. Even with all that happening, it will still manage.
Right.
But you continue to drink after that, and then all hell breaks loose, and then you'll end up with all the complications. One of them was portal hypertension. You can get into bad jaundice, you can start getting infections, you can start getting affection of the brain, which is called encephalopathy, and so on
Right.
and so forth. And the kidneys can get
Right.
affected, heart can get affected, so you get what is called a multi-organ dysfunction coming on as the liver gets you go into what is called decompensated cirrhosis.
Right, doctor. That was quite an enlightening thing. So it is that at every stage, because the liver is the only organ which is able to regenerate itself, at every stage, if the person stops drinking, then these progressive stages can be prevented. A. And B, if they receive help in the right time, someone who reaches a stage of, say, cirrhosis or fatty liver or grade 4 fatty liver, and is on the tip of cirrhosis, definitely cannot stop drinking without help. And by help, I mean a residential rehabilitation care in an environment wherein the person realizes and goes to with a sense of realization that I need help. And that system needs to be very holistic, like we have at Anatta. And bringing it to the fore is that it is very essential in that situation for the family members to be aware that where their loved one's health is deteriorating over a period of time as a consequence to drinking alcohol to a heavy extent. So the family members who are watching this, in fact, can be guided if they connect to the right addiction counselor or experiential counselor. They can be guided into how their loved one can be motivated to at least meet the counselor once, and then that person will take it forward, because an experiential person is somebody who has been in the position of the person who is drinking, who has received help at the right time, and is today living a clean, sober, and complete life. So, such a person is very motivational and inspiring to someone who is drinking currently and who is in a bad shape physically and mentally. So, a holistic care is what is essential. So, one putting, as you put it very rightly, Doctor, cirrhosis is not something that only affects the liver, but eventually affects every organ of the body. So, in that case, as was as Dr. Jairajani, our team psychiatrist, puts it very bluntly and very simply, that alcohol results in a rot of the body. It is not that the person will die, but the person rots from inside out. Correct me if I'm wrong, Dr. Khanna. And
No, you're absolutely on the dot on that, Dr. Sujata. It's you've
yeah,
stated it very well, and I I I am really appalled and dismayed to see, on cigarette packets we have put up that skull and the four bones, and we
mhm.
write that it can cause cancer and this and that.
Correct, correct.
I don't see that type of anything happening about alcohol. We should get all these things pictorially also on alcohol. Do you know that, I'm sure you know it, that the incidence of
Mm.
smoking, especially in young adults, is really coming down now because of all
Mm.
this, a lot of publicity and lot of ads coming through the government on TV and other social media. But
Right.
unfortunately, I don't see that happening in alcohol. So I often
See,
tell my alcoholics, when they come with their families to me, that they say, "क्या करें sir, मजबूरी है, ऐसा है." They will have, you know that better. They will have n number of reasons to say why they are
yes,
drinking. Why.
yes.
So there is a very famous couplet from Faraz, which
Mm.
I tell them that in बारिशों से दोस्ती अच्छी नहीं फराज, इन बारिशों से दोस्ती अच्छी नहीं फराज, कच्चा तेरा मकान है कुछ तो ख्याल कर. You're, you
Very
can you can still save your home,
correct,
because
very true.
the sickness of one alcoholic not only destroys him, it destroys the whole family. It
Yes,
destroys the entire family. The entire two generations get affected. His elderly parents and
right.
his children, his wife, obviously, everything,
Yes,
everybody is in disaster. And apart from the social consequences, you know,
you're
accidents
abs. Yes,
and getting into legal problems and all that, it's so, it is so devastating to see that. So I think what you said is very true. The need of the hour is good rehabilitation.
yes,
Most
absolutely, doctor.
alcoholics tend to take it very lightly. Sometimes I've seen families also saying that, oh बेचारा क्या करे, वो तो पीता है थोड़ा सा, अभी आदत लग गई थी, क्या करें डॉक्टर साहब. I'm reminded of Mark Twain's famous words on smoking, which he
Mm,
said, "It's so easy to give up smoking. I've given it up dozens of times." So
right,
it's like that. They give up alcohol, and then there is a very high incidence of recidivism, that they keep coming back to it. They will give it up for some
exactly,
time and they will keep coming. That's our biggest, fear when we recommend patients with bad alcoholic livers for transplant. The family goes through a transplant. It is a very, very major drain on the family, economically, financially,
yes,
emotionally, everything.
yes.
And then the worst thing which can happen is that few months after that the guy goes back to alcohol. It's all
So,
over.
but doctor, that is exactly why a person who requires a liver transplant first needs to be treated for the alcoholism. As you rightly
Very
said, the incidences of what we call relapses are very high in someone who drinks, because that is the nature of the disease of addiction. It is a relapse prone disease. However, someone who drinks and he's able to stop for a certain period of time, because somewhere unconsciously that belief is there, or that understanding is there, I can always start it whenever I want. So that starting and stopping reaches such a point where the duration of period between the periods of when he has stopped starts reducing over a period of time, till there is no gap and the person starts drinking every day. And that results in a stage wherein it is the alcohol that finally controls the person. It is not the person's ability to control the consumption of drink is over and is done with. It is no longer in his hands. And the unfortunate part, doctor, of what you just shared, where the family also starts giving in to that person's excuses, is because the family is not aware of the nature of the disease of addiction, unfortunately. So even our effort from Anatta is to, through these sessions and through these webinars, to increase awareness even amongst the family, because they need help first, because they are the ones who pick up the phone and call a rehab or call a counselor or call a psychiatrist or take their loved one to a psychiatrist or to a doctor or to a physician for help. And they need to understand that they require as much help as that person, because their lives are revolving around that person, trying to control that person's drinking. And in a sense, they lose their sense of identity, whether it is a spouse, as you rightly said, doctor, 3 generations or 2 generations. I would say three, doctor, wherein it is the elderly parents, it is the spouse of the person who's consuming the alcohol, and the next generation of children who are equally affected. All 3 generations need help. So for us at Anatta, family therapy is equally important. And many times the family comes to us for treatment, even though the person who is drinking might not come or might come after a long time. But when the family changes their ways of enabling, like making excuses for their drinking, justifying their drinking, giving in to that excuse of the person or that manipulation of the person who is drinking, because he does not know any better. But if they are empowered with knowledge, and if they are empowered with a system wherein they can take care of their own emotional states, that creates an unmanageability for the person who is drinking and motivates him or her to come into treatment. So, doctor, that is so beautifully put by you, where you shared about your helplessness. I'm sure you might have felt helpless at several moments when you see this person keeping on coming back and back to you every time, right, doctor?
Very true. And when you tell them to go for rehabilitation, they say, nahi, nahi, they will find another 1 dozen excuses.
Correct, correct.
I often tell them, शराब बंद हो, ये साकी के
Hmm.
बस की बात नहीं.
सही
शराब
है.
बंद हो, ये साकी के बस की बात नहीं. तमाम शहर हैं, 2 4 10 की बात नहीं.
एकदम सही कहा आपने, एकदम सही
You,
कहा.
where Saki refers not only to the one who's giving him to drink, it's often the
Yes,
wife, or sometimes
correct,
the mother के बेचारा है दे दो and all that sort of thing. And
correct.
बहुत दुखी है, बहुत मुश्किलात में है, this that. I think the
Right.
time has come to educate society. Just like
Yes,
if we can do that for tobacco, we should be able to do that for alcohol. It causes
absolutely. It's
so
creating
much
so
of
much of a
misery. It
havoc.
caused. Yes, yes, yes.
So much of an havoc. And it is not that everyone who drinks has to become an alcoholic, but everyone has the who drinks enough has the potential to become one. And here,
Very important, very important. What you said is
yes,
the crux. That first drink which you have taken is always a tipping point. You never know how many of them will be able. This whole thing of socially acceptable drinking, I think, is a big farce. There are very
yes,
few people who will stay socially acceptable drinking. And that entire thing that the patients will come and tell you, yeah, I have read that red wine is good, and it's good for the heart, it's good for this. But how many of you will stay within the limits of that red wine which is allowed? Very few.
correct.
Very few. The majority will just find some reason to tip off, and then you're waiting to get into a big problem.
Correct. Absolutely right, doctor. See, because it is that, and today the concept of when someone comes to us and says that I drink socially, it is my so and so who has the alcohol problem. The very concept of what is a social consumption varies from person to person. So I always ask this question: what, according to you, is social consumption? Because let me tell you, the young people of today, those who are in their early 20s or late adolescence, when they consume alcohol, they consume it in order to get drunk, not to enjoy their drink. And this has been told to me by many a young person, that what is the point of drinking if not to get wasted? And
True.
that is a very shocking thing to listen, and a very what I would say, a very scary thing, because then that is an entire generation who's waiting to become our future clients. It is very unfortunate that I have to say that, but that is the reality of today, of society today, of where consumption of alcohol has increased. And this is not related to any one particular gender. Today, there are no gender biases where consumption of alcohol and drugs is concerned. Both males and females consume alcohol very openly and in huge quantums, and to the point that they need to be very aware of where it is leading them to and where it can take them. Hence, these webinars to increase the awareness even amongst the youth of today, that hello, hold on, pause, wait, is it worth it? Do you really need that drink to enjoy? The concept of having fun has changed today in society, unfortunately. But that has happened over a period of time, even where adults are concerned, or even the youth are concerned. So somewhere there is an emulation of the adults around also. Doctor, would you comment on that, please? Like children watching their
Yes,
parents, or
yes. Yeah. That's a very moot point you made. That, when they see adults drinking at home, the child feels that's normal.
yes,
And then if you're setting a bad example right from there, and then the child feels that that is part of normal behavior. That if my mother can drink, my father can drink, my uncles, aunts, and everyone at home comes and drinks, and that is what they use for everything. When they are happy, they drink. When they're sad, they drink. Whenever they want, they drink. It's never
correct.
going to end. The child feels that's normal behavior. I know
Yes.
of young girls who come to me from villages, especially
Hmm.
from the north, where I see a 13, 14-year-old boy or girl smoking heavily. So I asked
Yes.
them, कैसे शुरू हुआ? तो बोले, नहीं नहीं, कुछ नहीं, वो दादा हमको बोलते थे वो बीड़ी जला के लेके आओ हमारे लिए, तो हम जाके जला के
Hmm.
लाते थे, रास्ते में एक दो बार हम खुद भी लगा लेते थे, तो कोई कुछ
Hmm.
बोलता नहीं था. So it's considered as the done thing. And you, as you said very rightly, the training for this, or the precautionary teaching for this should start at the school level, right? From
Absolutely.
what is the youngest patient you have seen, Sujata, for my information?
Our youngest patient has been around 17 years old, doctor, because legally we it's a little difficult to take kids younger than that. But we have had inquiries of children even as young as 10 and 11 who are consuming
That's right.
alcohol, who have become addicted to alcohol or marijuana, who are consuming marijuana and weed. So it's not that we have not come across them. So it does happen. It's getting younger and younger, and hence we need to be more aware. And at the same time, doctor, putting it in perspective, that there is no blame here on somebody, even either on the parents or on the people who become addicted to substances, because no one asks to become addicted to a substance, whether it's alcohol or drugs. However, it is very important to understand that potential to become addicted and be aware and stop at a particular reasonable level. So, doctor, what would be officially a social consumption that would be, that according to you medically is okay for a person to consume? Let's put it like that.
So very good question. Medically, as they said, two drinks for males per day, or one drink per day for female. That means not exceeding 7 drinks a week for a lady, or 14 drinks a week for a male, are considered within normal limits, and can be accepted. But you the whole ambiguity is built into the whole thing, is that what is a drink for you may not be a drink for
Hmm,
me, and
correct.
the volume of the drink changes. We are talking of standard drinks, like
Yes.
one drink of beer is 360 ml or 12 ounces.
Hmm,
One glass of wine is 5 ounces.
hmm,
One peg of whiskey, rum or vodka should be about 45 ml maximum. Okay.
Right.
Now, these three are equivalent to 14 grams of alcohol. If you have
Right.
one pint of beer, one
Mm-hmm.
glass of wine, or
Mm-hmm.
one peg of the hard liquors, rum, vodka, whiskey.
Yes. Yes.
The others come somewhere in between. So these are all
Mm.
equivalent. They give you about 14 grams. The moment you exceed 30 grams a day and you take it on for a few years, you are looking at a problem. You're looking at problems happening anytime. So there is just nothing like a social drink. I would say that my concept of a social drink is zero, no drink. Okay, you get, yes,
Absolutely.
but because you will not be able to tell them, oh, now you've had, you're not having a CCTV in the social room in the party going on, that, oh, now you finished, six for 90 ml, now you stop. There is no end to that.
It never happens,
You said
doctor. And
very
you've
rightly that people drink to get drunk and not just
yes.
for the relaxation. And there is the tipping point is the line is very thin. You can just fall into the other side anytime. All of us go through stress, strain, happiness, everything, and if you use that as your fulcrum or your crutch to start drinking, you're asking for
Yes.
trouble. The only drink
Absolutely.
which you can have is no drink. You have enough other things to,
Absolutely.
yeah, we have to educate our youth to come into healthier activities, sports, social work, military training, spirituality, exercise, something else which gives them a high. you know I'm sure
Yes.
with so many, now with our country doing so well in Olympics and so many other sports, we have to encourage them at the school level to get into good sporting activities, good academic activities. There has to be reward at the end. Finally, you know it better than me, Sujata. What does alcohol give you? It gives you a dopamine high. Okay,
Yes.
that dopamine high you can get from other things. You need
Correct.
not get it from alcohol. So you can get a much better dopamine high if you are going to be achieving in some other way. Why do you have to take
Absolutely.
it from alcohol? So
Absolutely right,
that
doctor.
is where our teachers and educationists and policy planners have to step in. And as
Hmm.
Mr. Praful Shah said very rightly there sometime back, that we have to see that the bottles are labeled, and then they show that these are very industry driven things. The industry
Hmm.
generates so much revenue that they don't want to get into a problem by
Hmm.
banning it.
Hmm.
And
Hmm.
we are a
Hmm.
free democratic country. We
Hmm.
cannot
Hmm.
allow that. You do that, it affects your election chances, and all that other things come in. So how does one manage? You have to get some sort of median way to educate and make people understand.
Correct. So that's also what we are doing over here, doctor. And at the same time, for those who are already addicted to alcohol and who come for treatment to us, we incorporate a lot of joy in our treatment process. Like it is living regular life. There is sports, there is working out, there is games, there is going out for movies, there is going out for meals. So basically, that association of fun with drinking and using drugs is broken in treatment. And our very strong experience is that if you cannot have fun in treatment, how can you have fun in life? Because you're carrying that forth into the life that you lead ahead. So that is along with the work that they do on themselves, along with the meditation, the counseling, the writing that they do on themselves. This also is an equally important part. And also the family therapy, which is given equal importance, which happens parallelly to their treatment. So, as
Very true.
Dr. Menon had made a statement that there's a lot of, in different countries, different quantities of alcohol are considered to be safe for the intake of males and females. And would you like to comment, Doctor?
Yeah. So that's a very good point by you, Sashi, that there are different, but overall we know that the amount which is going to damage the liver. So you
Yes,
take
yes.
more than 30 to 40 grams of alcohol a day, which just means three beers, okay, which doesn't mean too much. Three
Hmm.
beers and you're done. You keep taking three beers over a period of time, and you can land up into a lot of problems. And everyone feels beer is not alcohol, it's just 5%. What is the problem? It's a light drink, it's a social drink, it's a ladies drink. There is no such thing. There is no such thing. It can, when you're if you're unlucky, you're going to get hit somewhere or other by alcohol.
Right. Thank you, doctor, for
Whatever the
dispelling that
output.
myth. Thank you for dispelling that myth. Mr. Rajesh Menon is asking that how can one identify that the alcohol drinking is causing a problem to you slowly? How is that? How can one identify within oneself physically that it is
Yeah,
becoming a problem?
so good point, Rajesh. That I will stick to the only to the physical part. The other part,
Yes.
my co-host is much more qualified than me in talking about. And the as we said, you can start having problems in the mouth once you start feeling your taste is disturbed. Once you start feeling that your mouth is getting sore, okay, you can't eat well, your appetite is going down, then you might start getting feeling problems in the food pipe of burning in the chest, pain in the tummy, which you can get due to gastritis or inflammation of the lining of the stomach, and
Yes.
hepatitis. Again, your appetite will fall when your liver gets inflamed. One of the worst emergencies you can get due to alcohol, Sujata, I think, which we have missed
Yes.
out, is on the pancreas. The pancreas
Yes,
is
of
an
course, that
organ.
was
Yes, the pancreas is an organ which is exquisitely sensitive to damage by alcohol. And once you experience the pain of acute pancreatitis, most patients would feel that that possibly was the worst pain they ever had. And the pancreas is very, very important for you to have a good quality of life. You damage the pancreas, you will get, in the long term, you will get diabetes, you can even get a cancer of the pancreas, you will start getting
right.
diarrhea in the long run. So
Right.
these are the various ways you will get problems due to alcohol. Rajesh, I hope that answers your question.
So, doctor, going more in detail to where the pancreatic affections are concerned because of alcohol, this is a portion which is very oblivious to most people who drink or those who are addicted to alcohol because not everyone gets affected by pancreatitis. However, there is a very slow, insidious damage that is happening. Could you please elaborate on that?
Yes, very well put. That, again, it will take a few years of regular heavy drinking, that
Hmm.
which will damage the pancreas. But that it can happen very soon. Sometimes I've seen even patients tell you that they've been drinking just for 5 years and they're
Hmm.
done. They have already landed up with chronic pancreatitis, and
Right.
in between they will get these acute exacerbations when the pain can be very severe, make them take go look for emergency pain relief in the middle of the night. They will be going to
Hmm.
nursing homes looking for a narcotic shot. So it's one of the worst conditions to live with. Pain of chronic pancreatitis is hell. It is hell. There is it frustrates the patient, it frustrates the doctor, and there are, believe me, the treatment is not really very ideal. You will have to go through any number of treatments. You might need endoscopic therapy, you might need surgery, you will need lithotripsy. A whole lot of gamut of treatment is available. You may have to go for a celiac nerve a ganglion block. We have a number of treatment, and whenever you have many number of treatments, you know that none of the treatments is very satisfactory. That's why you have these
Right.
multiple ways of treating the same thing. So the
Right.
pancreas
Doctor,
is very prone to problems. Yes.
right. Doctor, I have also come across patients with chronic pancreatitis who have never experienced pain in their life related to the pancreas. However, their lipase levels and amylase levels are over the roof, like 1,000 plus. How does that happen? Because I'll tell you why I'm asking this question is because a lot of our clients would be those who are already addicted to alcohol, think that are under that notion, get into that notion that I have never had pain where my pancreas are concerned, so it's okay. It's happening. The levels are high, but it's okay. I'm taking medicine for it. I can continue to drink. That is the myth that grows in their mind. So we need to dispel that. So I please elaborate on that part, doctor.
So again, you hit the nail on the head. Like most organs, especially in the gastrointestinal system, like the liver, the pancreas also has tremendous reserve capacity. You need to knock
Hmm.
out 80 to 90% of the pancreas before things can go wrong. So you will get
Okay.
diabetes, and you will get, the pancreas is a unique organ. It has both what we call digestive functions, what we call exocrine functions, and it has endocrine functions, which means that it produces insulin and some other hormones also. So
Hmm.
once you knock out a big chunk due to daily alcohol drinking, you will get into diabetes and you will start getting diarrhea and malnutrition. Pain is a very a very unique phenomenon. There are multiple mechanisms of pain in the pancreas. The pain can be, if you may have a fairly normal pancreas, but you have one small stone in the pancreatic duct which is just blocking, and you can get tremendous amount of pain. You can get
Okay.
inflammation sometimes due to a big binge of alcohol, and you can again get pain. So these are various things. That the pain is supposed to be either due to what we call ductal hypertension, the pancreatic duct getting blocked and pressure
Hmm.
building up in that, or
Right.
inflammation of the pancreas and enzymes, or sometimes the nerves around the pancreas getting inflamed, or what is called the neural component of pain. And then you can get a
Right.
compartment type of thing which is happening due to the fibrosis occurring around the pancreas. So there are multiple
Right.
mechanisms of pain. So sometimes your patients are just lucky that they don't have that
That
type of
there's
pain.
no pain.
Yeah, but they're stretching their luck. If they don't get pain, they may get diabetes, which is very difficult to treat, not like the routine diabetes. They may start getting what is called fatty diarrhea or steatorrhea, because the fats are not being
Right.
digested by the pancreas. that's
Right.
that's called steatorrhea. And of course, a cancer is just waiting to happen round the corner anytime.
Right. So it's a myth that just because one does not have pain because of the pancreatitis, that the pancreas are not getting damaged. The damage is happening and it is progressive. And yes, then the diabetes that develops as a consequence would most likely be insulin dependent because of the extensive damage that has already been caused to the pancreas. And that is in an invitation for further spew of ailments related to diabetes, which affects every part of the body as such, anyways. Doctor, you have mentioned over our talk, we have mentioned multiple times different types of cancers that are happening as a direct consequence of long term alcohol use and abuse. Could you please elaborate on that, doctor? What are the different types of cancers that alcohol abuse and alcoholism can result in?
So, as we already discussed, oral cancers, apart from cancers of the food pipe or of the
Hmm.
digestive system, esophagus, the stomach, the
Hmm.
pancreas, the liver, of course. Once you get
Hmm.
cirrhosis, you're a prime candidate to get what is called hepatoma or hepatocellular carcinoma, which will just
Okay.
happen anytime. Yeah, in almost 3 to 5% of patients, that it
Hmm.
can happen. And there is also an increased incidence of cancer of the breast, of the uterus in women, and
Hmm.
so many other organs can also get affected. So it's not just the gastrointestinal tract. Alcohol is a poison overall. When alcohol gets metabolized, Sujata, you form
Yes.
a very toxic substance called acetaldehyde. The first step of
Hmm.
metabolism of alcohol is by an enzyme called alcohol dehydrogenase, and that goes to
Hmm.
acetaldehyde. And
Hmm.
the acetaldehyde then causes a lot of problems due to um, attacking the DNA, attacking the
Hmm.
DNA. So and that DNA is present in each and every cell. So
Right.
your chances of getting cancer even in distal organs is very high. So if I can recall correctly, even cancers of the kidney and even
Hmm.
certain lymphomas,
Hmm.
non-Hodgkin's lymphoma, the incidence is higher in alcoholics. So
Okay.
it's a very wide ranging toxic effect which occurs throughout the body.
Right. I have seen people suffering from bladder cancers also, and also colonic cancers as a consequence
That's it.
in those who are
That's it.
coincidentally addicted to alcohol also. I'm not saying that alcohol is the only reason for these cancers to happen, but yes, people are more prone to get all these cancers because of long-term consumption of alcohol and the resulting damage that happens. So, doctor, coming back to the what would you cite as, have you seen amongst your patients who are also cirrhotic and who are having hematemesis, that is vomiting of blood? How often are they able to stop drinking on their own without help? Are they able to do so? Isn't it very difficult?
I would say just maybe 1 in 50.
Correct.
Very,
Right.
very low, very low, and as you know, the research has shown, alcoholism, when it reaches that stage, becomes a disease. You have to treat it like any disease, like you treat hypertension, or you treat diabetes, or you treat any other chronic disease. It's a disease from which the patient then finds it very hard to extricate himself. So,
Yes.
as
Alcoholism
I said,
itself is a disease,
yes, yes, yes. So there is,
whatever
we
stage.
know that there is an HLA linkage.
Yes.
That's why many times patients ask you very funnily. This
Hmm.
pancreas. I'm reminded of a pancreatitis patient of mine. He was a young
Hmm.
man, strapping, well built, very good looking guy, who started calling me every few days in the middle of the night. Doctor, now I'm getting pain, what do I do? So I would tell him, go to the nearby nursing home, take this painkiller, tell them to give. And then it started happening. Then I called him over. I said, come over, let me tell me what is happening. So
Hmm.
then the whole family came over and they gave me the history, and they said, doctor, do you know with whom he drinks? I said,
Hmm.
he has to stop drinking. But sir, do you know with whom he drinks? I said, I don't know. He said, we stay on the first floor of the building. On the ground floor of the building, our family doctor stays, and he is the best friend of my son, and they both go to drink together. और उसको कुछ नहीं हो रहा है, तो मेरे बेटे को ही क्यों हो रहा है? I said, I have no answer to that. That is karma phal. That is in your genes. You're going to get it, but your only way
Yeah.
out is now you stop. But
Correct.
unfortunately, once they reach that stage of severe pain, which makes life miserable for the whole family, stopping is it doesn't help. It's over. It's not like liver where you have a chance of recovery. Once your pancreas is hit and you start getting pain, your pancreas is hit forever. You will keep on getting,
The,
and then you will need a lot of intervention to get rid of that. You may need endotherapy, you may need
yes.
surgery, and so many other
Right.
things. What you mentioned.
Agreed, doctor. Agreed. But at the same time, if that person is able, through the right kind of treatment, that is rehabilitation, residential treatment, for not finding the need to drink again, then the physical recovery and the physical damage can somewhere be paused, or
Certainly,
the progress
certainly.
can be prevented, and the person can live a more fulfilling and a more productive life as a
Very true.
consequence
Very true. No
of this
question of that.
of
Right.
being able to stop. So there is also the point that because of lack of awareness and because of the fear of social stigma, most families and the person who is drinking also tends to hide the history of consumption of alcohol even from their own doctors. So you must have come across a lot of these patients also, doctor. How did you deal with that? Because it's very staring in the face that this person is definitely the consequence of drinking alcohol to an addictive component. So how do you deal with such patients and their families?
As you said, we have uh, my pet name among patients was Dr. Daruwala at
Okay.
some time when I was practicing in Bandra. By the way, I am now at the Holy Spirit Hospital and the Criticare. I
Okay.
don't go to
Yes,
Bandra
doctor.
any longer from the last couple of years. But
All right, doctor.
even over here, I see tremendous amount of alcohol, related diseases every day.
Yes.
So we have our own ways. Most alcoholics are very suave liars. They will fool you. They will fool the family, and they have their own way of hiding the smell from the breath by eating a lot of
Yes.
these other things which they cover the smell, and they have
Yes.
certain other drugs which they take which will keep them alert and all that.
Yes.
I know of a patient who used to take a certain antidepressant which would keep him awake, and then he would say, "मैंने
Hmm.
कहा किया है?" It just
Hmm.
went off. So we have ways of finding out. We have,
Right.
so from the blood test, we can tell very easily whether you're drinking. As I said, just one drink, and the next day your gamma GT or SGPT or GOT will go up. That's all you need.
Right.
There are certain other indications in the blood count which you can tell. The
Hmm.
MCV, the mean corpuscular volume of the red blood cells will increase, and
Yes.
platelet counts will fall once liver damage occurs. So it's not difficult.
Right.
It's not difficult.
Right.
One blood test or one look at the patient, and we often know. And physical examination, we can always tell whether the patient has been drinking or
Definitely.
not. There are a lot of telltale signs in the hand. There are about half a dozen signs. By just looking at the hand, we can tell how much he is drinking, how often, and for how long.
Could you elaborate on that,
Not for
doctor?
chemistry, just by looking at the hand. Thank you, Saluja sir,
How
for your comment.
how would you find out by
Oh, it's
looking at
very
the hand
easy. It's very easy. I'm sure you know, but for the benefit of your
for the
listeners, for your
viewers?
audience, I will tell, yes. For the viewers, I
Yes,
will tell you that one is, I just tell the most alcoholics, when they come to you during the day, and if they are heavy alcoholics, you just tell them to keep their hands out, and you will see a fine tremor. Especially if they are the types who need a morning drink. These are the
yes,
very hardcore drinkers, and they will have a fine tremor, because even few hours of not drinking will put them into withdrawal, and they start getting a little tremulousness. Their heartbeat will be fast. The pupils of the eye will be dilated. If you're very smart and you go a little near him, you may get the smell of alcohol on his breath.
right.
The face is often flushed, and you may see
Yes,
certain red spots, especially in the upper part of the body, which are called spider nevi. On the
yes.
hand, you might see a whitening of the nails, which is called
Hmm.
white nails or leukonychia, or you might sometimes
Hmm.
see white bands going across the nail, which is called Muirche's lines. You may see a,
Right.
a thickening of the fascia here, which is called a Dupuytren's contraction. Okay, and
Yes.
you often see a flushed, warm hand, often little sweaty, because he's nervous when he's come to you. And sometimes in advanced stages, the nails might get curved, and what is called clubbing might occur. So
Right.
there are multiple ways which we can, just by looking in one half a minute, I can tell you how much he's drinking and from how long. And
Absolutely, doctor.
whatever he says, that is immaterial.
Absolutely, doctor. And for the family, even a child can say that my papa is drinking or my mom is drunk, but just by the fact that the person is drunk and is absent to one's own life. So, doctor, finish. We have, I guess, just a few minutes more. So, finishing our today's very enlightening talk, doctor, what is the message that you would like to send out to the youth of today or to people in society? What would you like to convey of where alcoholism is concerned and how they should take care and how to feel joy in life? Could you please elaborate? What would be your message
So
be?
yes, so just to reiterate what we already went through, that
Hmm.
we have to have a, a set of societal values which gives importance to other things in life, academic achievements, sports achievements, achievements in the social sphere, achievements in spirituality, whatever. The sanskars which are passed down from the parents, from the seniors to the family at
Hmm.
at large, and at the
Hmm.
school level.
Hmm.
You cannot, you must set right examples, Sujata. You cannot have a
Right.
teacher who drinks and then who comes and says that don't drink, or you cannot have a
Right.
doctor who drinks and tells the patient don't drink. It doesn't work.
Correct.
So
Yes.
our social icons, our should be able to ban advertisement of alcohol on TV, on social media. It must be banned. Let earn money from other ways. Let
Hmm.
the government fill its coffers from other ways, but not
Hmm.
not by doing this. And you spend the same amount then on treating the guy for the rest of his life. So how does it
Right.
help? Yeah, in the name of
Right.
democracy, yes, I agree, prohibition is difficult, but there have to be disincentives, some other way, which KOLs like you should,
Hmm.
your institutions and other things, and all of us together, we have social responsibilities. Dr. Jairajani is online, I can see him. So these are
Yes.
people who should raise public awareness about this, and telling people once they are beyond the hill is not going to work. So we have to catch
Hmm.
them young, as they say, and train them, and
Yes.
give a dopamine high to the youth by all these other things rather than alcohol. Yeah.
Yes,
Make,
doctor. That comes.
make some
Yeah.
discipline. Some discipline has to come. You see small countries like Singapore or Hong Kong or Israel, where army conscription is almost compulsory for a certain
Yes.
period of the youth. You
Yes.
find how progressive these countries are, how strong they are, and how
Correct.
advanced they are in every way. We need to bring that type of awareness and into our society.
Doctor, and more so, including everything that you have said, more so, very important awareness and understanding and education that needs to be incorporated is about emotional intelligence. Because what I have come across in most of our clients is that the core issue is a difficulty or an inability to deal with one's emotions realistically and healthily. And this is not something that is taught, because unfortunately, even the older generation is at a lack where that is concerned. And hence, introducing this at a very academic school level of how to deal with one's emotions from a very young level can help in strengthening that person emotionally and providing the tools to be that, so that that person does not find so-called solace or entertainment in future use of any substance like alcohol or drugs. Prohibition, we have seen, has been a failed process in across the world, including our own country. You could take states like, wherever prohibition has been made mandated in our country also, amount of alcoholism existent in those states are very rampant, and that is the reality of today. So it is not even prohibition that will work, but as you rightly said, sir, awareness building, not only of the problem but of how to prevent it, and if the problem has occurred, then what are the right solutions to resolve it are primarily through voluntary, non medical, residential rehabilitation care, wherein what you mean by rehabilitation would be to train that individual, A, to not find the need to drink or use other substances, B, to find something as enjoying, as you said, to get a dopamine high or to get joy from other activities and other passions that the person can inculcate within themselves, and to rejoin society and families, wherein the therapists become a bridge between them and society and between them and the families. So rehabilitation does not end only in a facility. It has to be extended beyond that to the family and to society in every aspect. That is how where we at Anatta function very out of the box, doctor, very client specific. We have enabled several of our clients to rejoin whatever work they would like to. We have bridged families, we have bridged them to their friends and society. So we feel that is the true nature of what treatment has to be in its entirety. So, doctor, that brings us to an end of our conversation today about alcoholism and how it affects the gastrointestinal system. It was so enlightening and such a joy. I felt I was back in my classroom listening to you, or at your clinic and learning from you firsthand. And that was a great, great experience for me. Thank you, doctor. And as Dr. Menon also appropriately said, Rajesh, if you could just, that the appropriate role modeling for younger age groups, counseling and awareness programs in schools and undergraduate levels, understanding life reward systems, and more later punishment alone is not valid, which is very true. So they have to be treated with a lot of compassion and love, because one does not become an addict by choice. One does not ask for it. It happens. So each person who's suffering from addiction needs to be looked at with compassion and treated with dignity. And doctor, that is someone of your friend who is also
Yes,
thanking
yes.
you, Mr.
Thank you,
Manjeet Singh Saluja.
Thank you. Thank you, Dr. Menon. And
Yes,
very good inputs from our students, Dr. Khyati and Dr. Kanika Sabarwal. Thanks a lot.
yes.
I,
Thank you,
I
doctor.
too enjoyed the interaction and a lot of nostalgia being with you back, Sujata.
Yes, doctor. Likewise. Thank you very much for spending your Sunday morning with us. And
And give
thank you,
give
viewers.
my thanks to, to Dr. Vandana and to your team. Thanks a lot.
Definitely. Thank you. Thank you, Dr. Khanna. Thank you very much. And thank you, viewers, for being with us and joining us on this Sunday morning. Thank you from Anatta again. Till next time. Bye.